Hi, everyone. Welcome to the Open Nurses Psychedelic Chat. My name is Andrew Penn. I'm one of the co-founders of Open Nurses, and I am pleased to be joined by two friends and colleagues today, Diana Zamora and Kayla Kinsman. Diana Zamora is she is a registered nurse and holds nursing, respiratory therapy, and environmental science degrees. She brings over 10 years of experience working in long-term acute facilities and ICUs, and has served as a member of a patient ethics board in Houston, Texas. For the last 8 years, she's worked with rural California tribal communities and has led several statewide educational campaigns for HIV, STD, and hepatitis C awareness, and created community health worker and medical assistant healthcare training programs. Diana supports the professional development of healthcare staff working in tribal organizations with coaching, strategic planning, and training guidance for working in community health, and is a passionate advocate for health equity. Diana holds board certification in integrated nurse coaching and is a graduate of the California Institute of Integral Studies in Psychedelic Therapies and Research program, where I met her. And Kayla Kinsman is a doctorally prepared psychiatric mental health nurse practitioner who performs diagnostic evaluations and follow-ups to provide psychiatric medication management as well as ketamine-assisted psychotherapy. She earned her bachelor's degree in psychology from Sacramento State and attended Dominican University of California to earn a second bachelor's degree in nursing to be able to work as a psychiatric nurse. And while working as an RN, she found herself with a desire to be involved in more in-depth care with her clients and decided to go back to school to earn her master's degree at UCSF, which is where I met her, to become a psychiatric nurse practitioner. After starting as a nurse practitioner, she was accepted into OHSU, where she earned her DNP with a research project focusing on bringing psychedelic-assisted therapies to veterans with PTSD. She's dedicated to learning all that she can about the space of healing and has knowledge in multiple areas, including psychiatric medications, psychedelic medicine, herbalism, functional medicine, and other psychotherapeutic modalities. Kayla believes it's important to investigate all aspects of a person when formulating a treatment plan. I appreciate that about her. And utilizes active listening in her practice. She's been working in the mental health field for nearly a decade, and with most of those years serving veterans with PTSD, substance use disorders, and homelessness in a residential treatment setting. She also enjoys things such as spending time with her family and friends, camping and hiking. And she also gave me some of the best trips for traveling in Bali ever when I got to go there. So let me have them both come up on the screen here if I can. Welcome, Kayla. Welcome, Diana. Thanks for being here. And the thing that we didn't get into talking about was the project that you're going to be launching soon. And we're going to definitely spend some time talking about that today if we get to learn a little more about your background. I want to encourage the handful of people that are watching this live right now, if you want to pop in on the comments where you're watching from and what you're doing out there, that would be great. That way we know who's watching. And there'll be many people who are watching this on the recording afterwards. So Kayla, Diana, welcome. Welcome so much. So glad you're here.
Thank you, Andrew, and thank you for the lovely welcome. I appreciate it.
Yeah, you guys have great bios. So, we always kind of start these things similarly, which is to ask, how'd you get here? What got you interested in nursing and where it intersects with psychedelics? Kayla, can I pitch that to you first?
Sure, that sounds good. Gosh, it's a hard question to answer because I started out, like you said, with earning my bachelor's in psychology, thinking I wanted to be a marriage and family therapist. And then one thing led to another, and I became interested in working in more clinical spaces. So I was like, I'm going to be a psych nurse. So I did that. And then very shortly after that, started earning my master's to be able to prescribe and diagnose. And that's sort of when my interest in psychedelics came up, because we had to write a comp exam at UCSF for our master's. And I was deciding what to write it on. And I came across all the research on MDMA assisted psychotherapy and decided that's what it was going to be. And basically just never lost interest from there. So, a lot of my research in my DNP program was focused on psychedelics. And I just became fascinated by the results that I was seeing in the papers that I was reading. So here I am.
All right. Just it doesn't seem like that long ago that you were in my classes, but it has been a while. It's been a few years.
It's crazy. I know. It feels like, yesterday. So
those blurry COVID years. Yes. Sometime in there. Diana, how'd you find your way to this space? What brought you in?
Well, I definitely took the scenic route when it came to nursing. As you mentioned in my bio, I started off in the sciences and in the earth sciences. I started working in the laboratory with an associate's in chemistry. Then I went on to environmental science, and for over a decade, I did a lot of like environmental work. And surprisingly, I traveled a lot in South America during that time, like Peru and Bolivia and Ecuador on some projects. And I remember seeing the medicine around, but I was like, I grew up in the 80s, just say no, girl. So I was like never really like interested in that. I was more just interested in the travel. So circling back, I had a sister, her name was Janie, and she ended up with pulmonary hypertension during those years. And I lived in Houston because that was the energy corridor. And so she'd come to Houston, and she spent over a year in the, navigating the Houston Medical Center. And it kind of reminded me all those hours I spent at her bedside that I had initially wanted to be in medicine. So, she passed away like a year later, and it just kind of motivated me to get back into medicine. So I pursued respiratory therapy first, and then my nursing degree. And then, so after that, I kind of, during that time, I got introduced also, I wanted to work with marginalized communities, underserved communities, and this opportunity to move to California and start working with tribal organizations looked very promising to me. So I left the bedside. And at the same time, I was introduced to this nurse coaching program. And during that time, I started studying Reiki, alternative healing modalities. And somewhere along the way, I don't know when it happened, someone brought up ayahuasca, and then I kind of just did a deep dive. I bought every book that I can imagine at half price book on ayahuasca. And then I traveled abroad to do some research, and it's been a real interesting almost 6 years of kind of just doing a lot of self-exploration, and then some traveling, and then the CIS program. So, yeah.
So both of you went through the CIS program, which, full disclosure, I mentor in and also went through that program myself. That's actually how the 4 original co-founders of Open Nurses met. Were there things that we often get asked here at Open Nurses about, should I go through one of these training programs? Did it teach you something you didn't already know? Is it essential for doing this kind of work? What are your thoughts on that? Kayla, I'll pitch that to you.
I think it's definitely been foundational in my knowledge that I've, gained in psychedelics and things like that. It's primarily, didactics and theory courses right now, just because, the legalities related to the psychedelic field. So there's not a lot of clinical work, but, there's programs out there where you can do like ketamine experientials, since that is legal right now. So I think that's also been really helpful. But I think what comes like out of these programs more than anything is the people that you meet and the connections that you made. So, while I can learn, a lot of this information in any space, you can't really get the same connections that you're making in that space, elsewhere. So I think that's been the most important thing for me.
Yeah. Yeah. Diana, what about your thoughts on that?
I would definitely agree. I think as nurses, we know what our curriculum was to become nurses, and a lot of it had to do with, practicums and clinical rotations. And in a lot of ways, I wish this program that we were, kind of progressive. Once this becomes legalized, that we could have those kind of clinical rotations and practicums. Right now, like Kayla said, it was a lot of theory and a lot of sitting and listening to speakers and present. But she's absolutely right. What the best thing I gained from it is some really amazing friends that we continue to meet, and we continue to walk this journey together in peer support and through meeting. Like we were just together this past weekend in San Francisco meeting. So it's just really, it's a really good opportunity for that. So going back to your question, if I think it's necessary at this time, I think maybe if you lived in Colorado or Oregon, I think it would be a great opportunity because they do have, certified, programs. But I would think twice again about spending that year, except for like the great people I met. Yeah.
Yeah, it is the challenge of this work, right? Is that we're sort of preparing for a future that we don't know exactly what it looks like and what will be required, to work in this space. I mean, it's different than when we went to nursing school, because when we went to nursing school, nurses already existed, and there was a clear pathway. If you did these courses and took this NCLEX test, then you could go get a job that required you to be an RN. But the exact similar doesn't really exist yet for psychedelics. So, we're going to talk in a minute about the program that you guys are creating, but, I'm wondering just sort of foundationally, I mean, you both have really interesting backgrounds, and I know like Kayla from knowing you over the years that, that having this sort of earthbound connection in your practice is really important. And Diana, it was really interesting to hear you were an environmental studies person beforehand. And so, I'm wondering, what sort of perspective do you think, everyone's sort of trying to figure out how to have a seat at the table in the psychedelic world, right? So let me ask you this in a slightly provocative way. What makes nurses any different than any of the other groups of people? And does there even need to be any competition for that? Is there enough room at the table for everyone? Diana, can I pitch that to you first?
Sure. I think right from the start, I think nurses, especially the ones that have worked in ICUs, we've been working with people in altered states of consciousness, and like heavily medicated on morphine drips or propofol or things like that. And I just remember the old school nurses teaching me to be respectful and recognizing that they're still in there, and you treat them and you talk to them and during your 12 hours. And I think that kind of puts us ahead of the game when it comes to this kind of work, because you're there for 12 hours with someone and you're caring for them in every aspect you can imagine. And I think that trait definitely needs a seat at the table, or like I've heard in other circles, or we need to build our own table, so.
Kayla, thoughts on that?
Yeah, I mean, I agree. I think every discipline obviously like has something to offer within the space, but I do think sometimes nursing gets overlooked in the psychedelic space. I think people. I kind of think of it like like the OR. Like you help get your patient prepared to go into surgery, then the doctor or the surgeon's performing the surgery, and then the nurses are there to help them afterwards. And so I think sometimes that's kind of how people think of the psychedelic space too. But really, I mean, nurses are very good at being patient and present. So they're ideal sitters and guides. And I think, I mean, Deanna was talking about like in previous research where nurses would sit as guides, and you wouldn't see that in the research articles. So I think we definitely have something to bring to the table.
Yeah. I'm closing in on cleaning up the transcripts from our visit last winter to see Kay Parley, who's now, a nurse in Canada, for those of you who are not familiar, who was sitting with people under LSD in 1962 or something, who is now 102 years old and going strong. But yeah, she speaks to that, this way that we are with patients, and that it's not. I was also came back to Jean Watson last night. I was reading some of her stuff, and just her call for nursing being its own profession, that we're not, handmaidens to medicine, and that what we bring our own sensibility to that. And it sounds like this program that you've created really tries to capture some of that and draw on some of those sensibilities. So would love for you to tell us what it is. Tell us what you've created.
Okay, I think I can start with that. As as you know, it was my capstone project with you, Andrew, when I graduated from CIS, and
Yeah.
it was something that I felt really to create it from the heart of how I wanted to be taught. Like if I was a nurse coming in and I really didn't know about the psychedelic space, like what would be the foundation? Instead of spending 10 or 12 months in a program, what could I learn in a month or two and get some CEs off of it? And that's what I've tried to create with Kayla, is this foundational course for either nurses who are curious about what's going on in the psychedelic space, or maybe some nurses that have already been in it, but that kind of like to maybe a little refresher, or maybe just a point of view for somebody different, And so the modules are created like with the foundation of let's talk pre-scientific. Let's talk about indigenous use before we even move into Western and clinical spaces. So we spend an entire module on that. Let's talk about sacred medicine. So that idea came from I'm a big Terence McKenna fan, so all his everything that's on YouTube. And there was one retreat that he gave where he kind of gave this introduction of psychedelics, and he kind of did the worldwide view of like where he thought they originated in Africa, and then he kind of moved around the world. And that's kind of what I've done with the first module. We start with some ancient artifacts that have come up, some cave paintings, some artifacts that have been unearthed, and then we kind of move into Greece with the Eleusinian mysteries. We travel into Mexico, we talk about peyote, we talk about the mushrooms, we move to Peru, then we move to Gabon. So it's kind of like a little, I like to be a storyteller, so I try to give it like a story of that. And then we move into some things that happen that brought it into the Western world. Then, of course, we talk about Albert Hoffman. We talk a lot about Maria Sabina. We talk about Watson. Then we kind of break up some of the definitions of what the origins of like the word psychedelic, ethnogen, things like that. So that's kind of like what I wanted to start with, and that's like in module 1. And then module 2, we grow it, and then Kayla's kind of in charge of the last 2 modules that brings us into like the now, and maybe she'd like to speak about that as well.
Yeah, sure. Well, first of all, I just want to say that I'm only here because of Deanna. So thank you so much. I'm pretty honored to be teaching this class with you, but I'm going to be discussing the second 2 modules. So module 3 will focus on nurses and their holistic role in the psychedelic space, and that includes just information about like nurse theorists, as well as healers of both the past and the present. And then module 4 encompasses nurse coaching and kind of just the making of a psychedelic integration facilitator. So it's going to be good, I think, especially for nurses that are kind of just beginning their peak interest in psychedelics. And I listened to Deanna's first 2 modules, and she is a great storyteller. So I just have to
Yes, she is. Yeah. And I promise not to do the rest of this interview in Terence McKenna's voice.
Oh, no. Actually, I go to sleep. I use him to go to sleep sometimes.
Oh, wow. That would give me really weird dreams. But, to each his own.
I already have those, so.
Yeah, if you're not familiar with Terence McKenna, definitely check out his, he's no longer with us in this realm, but definitely left a lot behind and has a very distinctive voice. So really it's an overview of the past and also sort of what's happening now, and then looking ahead to ways that people might practice this in the future. But on
the second module, I do go into like the overview of each of the substances, and then again, I like to present it in a storytelling format. So I introduce the substance, and then we kind of talk about its mechanism of action. But then I pull in some research studies, and then kind of like the narratives that some of the participants have. I really like the qualitative kind of approach to some of the research, and I bring those in. So I try to teach about the substance, but also in a way that, I bring in the research and I let the participants tell their story. So that's kind of how I put together the second module as well.
Nice.
Yeah.
Yeah, Maria Mangini, who's kind of one of my mentors, has often said that nursing is an inherently qualitative profession,
Mhm.
and that we should be proud of that. You
Yeah.
know, that we tell stories, and that we, we might even shift report is a
Yeah.
kind of a qualitative process, right? There's these little data points of like blood pressure in the labs and whatnot, vent settings, but there is a story embedded in there about how the person is. And so it's so important not to lose that. And I think that's one of the places where nursing really like shines, in this work, is that like, yeah, mattresses and cap fives and all those things, all those quantitative things are great, but there's a story in there that we don't want to lose. So this program, there's a lot of the space is kind of, there's a lot of programs that will train you to be a quote psychedelic therapist. You've both gone through those, and as you pointed out, there's some shortcomings to those because that role isn't really yet defined, right? And there isn't a certification. There isn't an NCLEX equivalent for psychedelic therapists, right, that they can take. So it sounds like this is a program really for, if I understood you correctly, and tell me if I get this wrong, that this is really a program for nurses who are like, hey, I keep hearing about the psychedelic thing. I want to learn more about it. I do really well. I could go buy a book on it, but I do really well like interacting with things, and I want to watch some videos and some more kind of three-dimensional learning. But it's not a training program to be a psychedelic therapist. Is that accurate?
That's correct. It's like a course. It would be kind of like a semester course that you would take to kind of learn the foundations of psychedelics and where they're going with nurses. So, and that's kind of what we put together. And luckily, the Integrated Nurse Academy, who we paired up with, they've allowed us to put this together. It's also presented on Canva. So there's a couple of questions, like kind of like essay questions that we pose to someone, like, say after the first module, we'll ask them, what does reciprocity mean to you? And then they write their essays, and then you get to, answer, respond to someone else's answers. And then, so a whole dialogue can be started with your students, with the students online. So there's a couple of questions in there. And then what'll happen is Kayla and I will meet with them, what we're calling fireside chats. So after we give them enough time for each module, they'll meet with us via Zoom like this. And then we'll kind of like, they'll ask us questions of what came up for them, either through the essay questions that we're asking or through maybe some of the material that was covered. Yeah.
Okay. So those are group meetings that you do.
Yeah.
So they're scheduled group meeting times. Okay.
Yeah, it's kind of like formatted as like a 4-course or 4-module course. So they're pre-recorded lectures, and then after each one has their own kind of fireside chat. So
Okay. And you guys offer continuing education units for this as well?
40 CEUs will be offered for the course.
40 CEUs. Okay.
Yeah.
Wow. Okay. So somebody has a CE budget that's burning a hole in their pocket. This would be a great place to maybe invest that. That's great.
Yeah.
And who are your CEs are, I would imagine, accredited through
California Board of Nursing.
They're California BRN. Great. Can people, and California BRN units are often accepted by other states, if I remember right. I'm not an expert in continuing education, but is that accurate?
Yes, I've taken a couple courses through the Integrated Nurse Coach Academy, and they're accepted basically across the U.S. Yeah.
Okay, great. So this would be a way of getting your continuing education hours. And Kayla, you were saying this is sort of the last part is through a nurse coach model, and this is something I feel like we're hearing a lot more about. One of our co-founders, Angela Ward, is a nurse coach teacher, and so and runs her own coaching business. So would love to hear more about that perspective and how that is similar to what we might be familiar with as maybe bedside nurses, and how that might be a little bit different.
Yeah, I think actually Deanna probably would be better to speak on nurse coaching since she is one.
Great. But, whoever would like to take that one on, feel free.
So I did graduate from the nursing program, and that too was like a 10-month program, and you become certified. And And what it is it's actually, it can be used in so many different aspects. Like the recent nurse coaching push that I've seen is through Kaiser. And what Kaiser is doing is, say, for instance, you have a person who's newly diagnosed with diabetes, and everything that comes with that. So what they do is they'll set up 3 appointments where you meet with them, and then you kind of like, it's almost, I don't want to say therapy, but it's almost like therapy with them, where you come from a place where they say you listen with heart. And it's an acronym that you use, and you kind of question them, like, how do they feel about it? How do they feel about their care plan? The questions. So it's a lot of one-to-one nurse coaching, but it always ends up not being it doesn't end up being about the diabetes most of the time. You end up being, it's about something else. It might end up talking about childhood, or maybe about their parents, or maybe because they lost someone to diabetes and everything that comes with that. And then you help them, find support in other ways. And so nurse coaching, when I had to do my practicum hours, it was, you have to find people to coach. And I just remember coaching so many different people with so many different diagnoses, from a kidney transplant person to cardiac, had recovery from, cardiac issues and diabetes. And it's what we do in the bedside, but you're allotted a space, where you can spend that one-to-one time with them and really like listen to the patient like we always do. But actually, it's a one-to-one, and you're not rushed, and you're providing education, and you're providing support. So yeah, it's a beautiful thing. Yeah.
Yeah. Kayla, you want to add anything to that?
I was just going to say, it's really not that dissimilar, I guess, from being a PMHNP, where we do get that one-to-one time with our patient, and the content can be really sensitive sometimes. But it sounds like, Deanna, that you get more time with your patients, which is really nice. So yeah, it's a good perspective to have.
Yeah, that is a question that's come up. I've heard from a number of different places, is what is the difference between coaching and psychotherapy? And so, there does seem, as you point out, Deanna, to be some overlap there. How would you differentiate the two?
Well, if they start talking about grieving someone, it would be based on the stage where they're at. Like, if I can see that it's really affecting them, and then maybe they're heading towards depression, then I would recommend them, or help them navigate to get a therapist, because I do want to make it clear that nurse coaches are not therapists, but it could lead that direction. And our job as a nurse coach is to know when the coaching ends and when the therapy starts. And then that's when you have to do your referrals. So it's a really gray area. It also depends on your personal, where you're at. Have you done your work that you can sit in this and see where they're going? And can you provide them coaching, or does this person really need therapy? And it's a decision that, you have to make as a nurse coach, and also protect your license and your scope, because the last thing you want is for them to come back and them saying you're providing therapy when that's not in your scope, and you just have to be kind of careful about that.
Yeah. No, I've wondered about that, because, there are some roles that are more clearly defined. Like, so, as a nurse practitioner, I can prescribe medication, right? But when I was an RN, I couldn't, and I would have been out of scope had I tried to do that. The systems weren't really in place for me to even to be able to do that. But with something like therapy, it's a little more nebulous, like where something crosses over from coaching into psychotherapy. So I hear what you're telling people in your course is that if you're getting into more of like a clinical problem like depression or psychosis or something like that, then that would be a place to refer. With regards to like working, because one of the things that's, as I'm sure you're both aware, and maybe people in our audience are too, is that, one of the things that almost has to be kind of unlearned a little bit with psychedelic work is getting comfortable with things that in another context might look like an illness. If somebody's talking about, hearing their dead grandparents, in an ordinary state of mind, I'd think, wow, is this person having, a psychotic episode? But in a medicine ceremony, that might be totally normal. What do you advise people about how to figure out where, and we also know that people under psychedelics can have adverse events, right? I was just at a 3-day, Wendy and I were just at a 3-day conference in Berkeley last week about psychedelic safety, and how do we think about risks, and how do we categorize them, and how do we mitigate them in psychedelics, because they do, anything this powerful has risks, right? So like, what are your thoughts about, what do you encourage nurses to be thinking about as they're doing this work with regards to like, where is that line between normal weird and like, ooh, we're into something that feels uncomfortable and maybe even risky?
I mean, I would say that like intuition plays a big role in that. So like when you're starting to feel the discomfort, when you're starting to notice that things might become a little unsafe, I would say that's your flag, right? And a lot of the content, I think you just have to be prepared for anything to come up. So people will ask me, like patients that I take for ketamine assisted psychotherapy will ask me, well, should I have certain questions that I'm asking or whatever? And I'm like, you can have certain things that you want to cover, but also just be open to whatever comes up.
Mm-hmm.
And that does happen. So I think it's, and that's why it's so important to stay present and then be patient so that you're like paying attention to what your client is going through. And the second that you feel something is a little bit off, then it might be. So
yeah. I want to take a moment and encourage anybody who's in the audience who wants to ask a question of the two of you to please go ahead and put that in the chat, and we will be able to pull out a few of those towards the end of our conversation. So now would be a good time to do that. If there's a burning question that you have, just go ahead and pop that in the chat, and we'll be able to answer that. Please, if you put it in the form of a question, I'll be able to answer it better. Otherwise, you just leave it up to me to guess what you mean.
Andrew, I do want to revisit terminology. Like we are so invested in psychedelic-assisted therapy. Everyone knows psychedelic-assisted therapy. Can we maybe start having a conversation of what psychedelic care maybe could look like? And that's where nurses come in, because we provide care. So, and I mean, I even Googled it and there was like nothing. And I'm wondering if we need to start having conversation in nursing circles. What would psychedelic care look like? I mean, I was also having a great conversation with my friend Rosie on the way to San Francisco, and she's also a graduate from the program. And she said, Gianna, I've been thinking of, the way I do my nurse care management. I wonder if there'd be room for us to do like psychedelic care management, like, the after, like, when someone gets sent home from the hospital, you have a nurse care manager kind of make sure that everything's okay for you to succeed at the house. And she's wondering, why can't we have that in psychedelic care as well? So that's kind of like the new conversations I want to have. Like, what would that mean to you, Andrew, psychedelic care? What would that look like to you?
That's a great question. Thanks, Gianna. I feel like I'm now being interviewed. But I'll run with it. It's a conversation. Yeah, this therapy. I mean, I think therapy can include care. Obviously, therapy must include care, should include care. And I remember something that the dean of UCSF said years ago when I was a nursing student. She says, "Why does nursing think it has a monopoly on caring?" And this is coming from the dean of the nursing school, and I thought that was actually a good provocative question, right? Because sometimes it's like, well, nursing is the profession that cares, and it's like, what, like, because doctors don't care and pharmacists don't care. Like, I find that hard to believe, right? So like, but what is it about nursing care? So let's not say we have a monopoly on care, but let's say there is something that is unique to nursing or distinctive to nursing. What is that, right? it's tricky. It's like, people come out of psychedelic sessions, they're like, there was this thing and it was really important, but I can't really describe it. It sounds weird, right? Like it's ineffable. And I think nursing care is often that way. You know it when it's not there. Like ask anybody who's been in the hospital, like, how was it for you? And they're like, oh, I got great care. And if you ask a follow-up question, like, oh, what did they do? And they're like, oh, they were just all really nice. It's like, so is care niceness? I don't think so. Or if you ask people like, oh, I got, oh, it was terrible. I was sitting in the ER for like 8 hours and like nobody talked to me and I was hurting and like I threw up and nobody came by. And so like, okay, so the absence of care is neglect. Like how do we start to like kind of put a box around this thing, right? Like, what is this slippery thing we call care? And so we know it when it's not there. We kind of know when it is there, and like, this is where I go to Jean Watson, because like, this is what she spent her whole career trying to figure out. Right. And it's like, and so, I think a lot of what you're saying is like, we co-create this space with our patients, right? Like, so we learn about them, they learn about us, we create some kind of space together, and how do we do that? Whether if that's in an ER or at a psychedelic session, or in your postpartum discharge after you've just given birth, like you're creating something together. I mean, does that track with your experience, with your thoughts on this? Like, tell me where I'm wrong.
You're not wrong,
Okay, or tell me where I'm right. I'll take that too.
Yeah, I'm just wondering about, I guess that's great, and I think that's fabulous. So what you just said about nursing and care, but how, again, going back to my question, we talk about psychedelic-assisted therapy a lot, Pat. So I guess my thing is, I'd like to start having a conversation on psychedelic care, and what would that definition be, and what elements would that encompass? And it's not just about nursing care, but psychedelic care. Like, what would that look like? How would we define it? And that's kind of like the conversation I kind of want to start having, because they keep saying to nurses, make sure that you're not using the word therapeutic in your scope or what you're providing. So we have to be careful for that. So can we start using psychedelic care instead of psychedelic therapy? And then again, what would be the elements of that care, I guess?
Yeah, I think I understand kind of what you're saying. Is like the psychedelic care is like a more umbrella term for multiple, like the whole interdisciplinary team, right? And that includes nursing, that includes the therapist, that includes the MD. So I like that. Yeah.
Yeah. So is it a thing that we do? Because the therapy part feels like it's a thing, like we're doing a thing, right? Like it's a technique or a certain kind of agenda, or so whereas care, the way I'm hearing you guys describe it, is more a way of being.
That sounds right. I mean, it's I guess it's more like, just be prepared for anything that shows up and be open enough for whatever it shows up. And it's not you're not going to follow a protocol. There's not going to be like a step to step, of what you're going to do when something happens with one of your patients that's using psychedelics. You're right. It's more of a being and an openness, and but again, it's almost like, I don't know. Sometimes I need definitions. And I don't know if that goes back to nursing, and all the theories we had. I just need for it to be kind of spoken to me of what that would be and how nurses can be there. Because like, if you don't want us to be in the therapeutic sense, in the therapy part of it, because you're saying that's not under our scope. So what can we do under a scope that we can call care?
Right. I mean, I think therapy has often suffered from being a little bit nebulous, right? Like, how do we define it? If there's any therapists on the chat who want to take me to task on that one, I'm totally open to it.
Mhm.
But like if we were gonna like make some obvious things, like sometimes it helps me to think these things through. If I start with like the most obvious, like if I cut somebody open and reach around inside their guts, I'm doing surgery or murder, like one of the two. But like if I'm skilled, I'm doing surgery. But I'm not a surgeon, so I have no business doing that. Right. And so there's a really clear cut like thing of like you crossed a bright line as soon as you pick up a scalpel and cut into somebody, right? Like you're now doing surgery. Therapy, less clear, like, and especially therapy coaching. I mean, I'm really glad we're having this conversation because it feels like this gets thrown around a lot. And there's also a lot of like people kind of doubling down and protecting their turf, their professional turf. Like, we went through this as nurse practitioners with medicine saying you're practicing medicine without a license, right? And now what I'm hearing is like therapists saying to coaches, you're practicing therapy without being a psychotherapist. And so it probably would behoove coaching to get really clear on like what the difference is, right? Because it would probably help therapists really get clear on what the difference is too. You guys to come together and figure out where those lines are drawn.
Yeah.
Or even if they matter. I mean, I think the thing that I worry about with the not knowing where the lines are is that the risk of doing something that when you do the things you don't know what you don't know, right? I mean, there's that's where I think it gets tricky, right? So yeah, there's some good questions coming in to here. Maybe we can bring these in. Like, let me find one here. Let's start with this top one here. And this actually kind of speaks to what we're talking about. Like, a straightforward question for you, Deanna. Do you feel that nurse coaches with the proper training are qualified to offer integration in the psychedelic space?
Well, thank you, Jasmine, for that question. I think nurse coaches, and particularly the program that you go into, like I said, it's a rigorous 9-10 month program. I'm not sure with the proper training. So that's really open right there with the proper training. So when you're saying maybe the CIIS training or maybe the Colorado training or the Oregon training, I think part of it depends on what state you're in. Because if you're a nurse coach and you're practicing in California and you're going through that program, like your only option right now is to work in the ketamine spaces. And it also depends on the clinic itself. I mean, the clinic, they have nurses doing the IVs, they have the nurses doing the IM injections, they're sitting there with them, but it all goes back to how you're using the word integration. And it goes back to kind of like nurse coaching and therapy. So that would be another word, like, when we talk about psychedelic care and we talk about psychedelic therapy, now we have psychedelic integration, which could mean so much more. So I think, yes, with the proper training, because that's me. I'm a nurse coach. I've gotten the training. I think I still need a lot of practicum, and I'm hoping that in the future there'll be supervision hours as well. And that's what my hope is just to move. We talk about nurses from Brenner is like from novice to expert. Mm-hmm. I expect to be a novice for maybe the next 10 years in this space, So yeah.
You might be underselling yourself, but I appreciate your modesty. I mean, one of the questions that came up in this conference this last week was the issue around kind of harms that occur following a psychedelic experience. So, this idea of like ontological shock, right? Like if you have a big psychedelic experience and suddenly afterwards you're like, things don't seem, my world as I saw it doesn't make sense anymore. And that's scaring the hell out of me, right? Because I mean, that might be fun to visit for a few hours, but like when you come back down and you're like, things just don't seem right. I feel off. I'm not sure what's real. That's where people get destabilized, right? So, I mean, what would you tell people who are learning to do this kind of coaching? Like, at what point should you kind of escalate this, right? I mean, I mean, I was thinking this weekend about like first aid, right? Like first aid, CPR, BLS, great thing for everyone to know. But there comes a point where you have to realize, like, I'm over my head. Like, this needs 911, this needs an ER, this needs operating, this needs more than what I can do, right? So like, I wouldn't want to try and be, intubating somebody in my living room. You wouldn't want me doing that, believe me. It's been so long I can hardly start IVs anymore, but it'll probably come back to me. But so like, where do you see that? What do you explain to people in your program about like, where should you decide to like maybe escalate this, and what would be the sign to do that?
I'll leave that to Kayla.
Yeah, I was just going to say, I mean, like being a PMHMP, there are a few words that I think of as like suicidality, homicidality. When you're starting to not be able to differentiate reality from whatever you might be experiencing, like you might be having delusions or something like that. You might be hearing voices or seeing things. That's when I would start escalating things. And also anything that might cause like functional impairment, right? So you're not able to perform your day-to-day living. You're not able to take care of yourselves, things like that. That's kind of what I would look for.
Yeah. So when people are really at risk to not be able to take care of themselves. Boy, that sounds like a nursing diagnosis. At risk to not be able to take care of yourself.
And I think it's important to have a mentor and a peer support group of your peers to support you as a new person. That you're diving into this. So if there's somewhere that you can get mentoring, and if there's a possibility where you work, especially at the beginning with two people, like you're integrating with two people, maybe a clinical psychologist or PMHP, and then a nurse, that would be great as well.
Mm-hmm. Yeah, that makes sense. This sort of a more drill down on this question a little further. This is a specific question about how do you feel about distinguishing spiritual emergency versus something like a serotonin syndrome or a psychotic, I'm going to editorialize here, a psychotic experience. And have you experienced this? Have you witnessed this in working with people in unordinary states?
That's a good question. I mean, I think that's where your assessment skills as a nurse come in. So like if you're noticing symptoms of serotonin syndrome, like and this is why vitals are important to take to. So is their heart rate increased? Is their blood pressure increased? Are they having like mental status changes, which is obviously hard to assess in this situation. So I appreciate the question because I mean I haven't encountered it myself yet, but that's why we have practice, right? So
yeah. Tiana, you want to add anything to that?
I don't know. I'm kind of focusing on the spiritual emergency. You were talking about how you come out of it and you think that it's just, the life that I was living is not just really where I want to be. It's like totally different than when you were living your life. And it goes back to, was it William James in 92 when he wrote that book about the noetic qualities, like what you're going through is more real than you could ever imagine. And so it's like a fine line of like, when does it go into that spiritual emergency? Where does it go from that noetic quality to that spiritual emergency? So that's a really interesting question, and it's something that definitely I want to sit with. Yeah.
Yeah, and it seems like it's an added layer of challenge that the psychedelic space is more comfortable, at least in our discourse around like this idea of not pathologizing non-ordinary states, which in general I can get behind. But then it also sometimes seems to cross a line into kind of romanticization of them. I was at a thing a couple of weeks ago, and people were talking about how we're going to bring this to the mainstream and and this is in Berkeley, and I was walking to BART, and on my way to BART on this drizzly rainy night was two people literally passed out asleep in the sidewalk. Probably if I had sat down and talked to them, probably were suffering from some kind of chronic severe mental illness and or substance use disorder. And it was kind of a bucket of cold water in some ways, because it's like, oh my God, we're talking about this like kind of pie in the sky ideas. And like, we literally have people like in our cities sleeping on the ground in the cold because they're mentally ill, and it's like, gosh, I'm not expecting you to have the answer for how to solve for that one, but it really kind of gave me a moment of like, okay, this is, I don't think these people were having spiritual emergencies. I think they were medically ill, with a mental illness. And there are some spaces in psychedelic space that it seem even uncomfortable kind of calling something a mental illness, that they want to call it a spiritual emergency or something like that. And I'm not saying that spiritual emergencies don't exist, but I'd also feel like it can be over applied. Yeah. Another question here, like, so this is coming from CC. She's asking, that these are obviously medicines that existed long before Albert Hoffman stumbled across them, and all the other Sasha Shulgin and all the folks that have come in the recent last 100 years or so. Long indigenous tradition, different ways of doing this, in cultures that didn't have psychiatrists and psychotherapists or even nurses. How do you square fit these things? How do you teach both?
I think I'm gonna build on how I started my whole CIS thing is, and a lot of people know it, and I think, Andrew, this story about me. Before I even considered going into the CIS program, it was important for me to travel to Oaxaca, to Hualta de Jimenez, where it all started, to ask for permission to even like take the course, because to me, it's that cultural part, and I think it was a little bit missing from our program. Is the importance of starting your journey in that respectful way. That it was pre-scientific. Let's just call it that, pre-scientific indigenous use for thousands and thousands of years, and it looks like it's getting lost in all this medical clinical terminology and protocols and things like that. And sometimes I feel like it would be great if we just had partnerships in these cultural places where we would do our practicums, or maybe we could do a lot of the work there to get the proper training. That would be like the perfect program that I would love to do, is a combination of that, where yes, the theory is important and Western medicine is important, but so is the indigenous use and pre-scientific use in all the hundreds and thousands of years of the knowledge keepers. So that's where I'm at on that.
Yeah. And Kayla, I know that you have a deep interest also in like Celtic traditions, and you wrote your capstone on this sort of the Celtic use of psychedelics. And any thoughts from that perspective?
Yeah, I mean, I think I was just really surprised when I was doing my research how similar some of the stuff was, and all the different parts of the world. So I did Celtic and Nicaragua because I have ancestry from both. And I would just pick up on things from South America, Central America, and then European lineage. And it was all very similar. And so it's interesting because I come from like such a westernized education, and that's why I wanted to do a deep dive on this, on the background of it, to try to bridge the gap between the two worlds. But we talk about, togetherness and psychedelics all the time, and that was something I really noticed when I was doing my research for my capstone.
Yeah, there's something kind of almost archetypal across cultures with psychedelics. The trappings may be somewhat different, but there's something at its core that feels familiar across different cultures. And I know you talked about that in your capstone. Yeah, it just, as we're talking, I'm thinking like, it's no wonder we're struggling with reconciling these things, right? Because on the one hand, it's like there's this very medical kind of way of looking at this, and it turns on a 2A receptor, and that turns down the default mode network, and it makes cells grow, and yada yada yada, and then a miracle occurs. And then on the other hand, there's this like, you ingest a spirit, and spirit speaks through you, and that is what heals you, and it's like the two couldn't be further apart, right? But yet, like, when we're trained about how to use aspirin in a MI, nobody's talking about like willow bark, right? You know,
Yep.
we're not like giving thanks to the willow tree as the person is having unstable angina. You know, we just say this is a, you know, this is an anti-inflammatory drug. It decreases platelet aggregation, blah blah blah. You know, and we don't think about the two, and so it's no wonder that we're grappling with this. You know, and it's not to say that like one is more valid than the other. I think they both have a place, but you know, it seems like you guys have really situated yourself at that sort of the you know, it's the pull of the tug of war. You know, like how do nursing is finds itself in that, but maybe it's not a tug of war. Maybe it's like a, how do we bring these different elements together? Somebody, you know, Olga said this, you know, that holistic nursing really, you know, brings that mind, that connection together, and two-eyed seeing. I like that. It's a metaphor. Yeah. So how do people find your program?
If they go to inurse.com or they Google psychedelic pathways or nursing pathways in psychedelic care, that'll take them to the INCA website. So again, we're co-creators and we're co-faculty with INCA, and we hope that this is the first of many projects we work with them, because, you know, we're already being asked like, well, can you do one on just ketamine? You know, can you do a 4-module? You know, so our hope is that this lays a foundation for people to know, you know, where Kayla and I are coming from, and we're trying to develop or create a program where ceremony meets science in a way, and we just hope that this is just one of many that we have planned for the future. Yeah.
Where ceremony meets science. That's a really nice way. That's a nice note to end on. Great. So, and just some pragmatics. So if people want to do this course, do they need to enroll by a certain date, or is it ongoing enrollment? Like, how does that work?
The first class starts March the 31st. So they need to register soon. And then I think we'll be offering the course twice a year. So hopefully we'll offer it again sometime in August. I think we're talking again. Yeah.
Okay, great. So March 31st. So coming up soon, just next week. Really, if people wanted to join this. Okay, fantastic. We'll definitely put the date on. We'll put the link on the YouTube notes so people can find that. And I think it's also linked on our Facebook page that we put there today. So if you want to learn more, you can go check that out. And is there a way on the website for people to contact you if they want to ask you more kind of specific questions?
They have, yes, they just kind of put together our academy emails today. So that's in the works, but they can always ask the admission counselor for any questions. And Cece's asking about the live chats. So oh gosh, Kayla, do you remember our dates? I think it's like every 2 weeks after March the 31st. I think it's April 7th and then the 21st, or no?
Yeah, I think you're right. I'm like, I know that I screenshotted this somewhere.
So I think it's like, you know, so, and then the live chats will also be recorded for those who can't attend the live chats. So yeah, thank you, Cece.
Okay, looks like Jasmine's going to send it to Cece right now. See, look, we're already a community. People are helping each other out in the chat, so fantastic.
Thank you, Jasmine.
Well, traditional last question we always end these interviews with, this seems appropriate here. Is there something that if you could go back and tell your younger self, whether that's your kid self or your young nurse self or whatever you want to pick, point you want to choose, give yourself a little bit of advice, what would it be?
I think
I'm gonna give that. Oh,
go ahead.
Go ahead, Kayla.
Kayla, kick it off.
You know, when I think of that question, since we're talking about the psychedelic space, I'm gonna talk to myself like 5 or 6 years ago, before, or right when I started getting into this, and that is just to be patient. Because when I first learned about it and I first started researching it, I was so excited, and that excitement sort of clouded everything else that comes with psychedelics, which is quite a lot. And we're still in the process of making this happen, and it's a slow, gradual thing. And so I would just tell myself to be a little bit more patient.
Mm. Deanna? That's
I
beautiful.
guess, yeah, that was. I would tell myself to travel more to sacred places, embrace my Mexican culture more so, and the language, because it's going to bring you back to your truth. And you used this word a little while ago, believe in miracles. And what I mean by that is, I think it's Course in Miracles indicates that a miracle is a change in perception. And so I just want to believe in and recognize that there's a lot of miracles in the world, and and there's some miracles in these plant medicines, and we just have to meet them in the right space. And I highly advise that everyone do their own work before coming into the space, because as a sitter, you bring everything that you are to that space, and it's important that you do your own work as well.
Wow, that's really beautiful. Great way to end, friends. Thank you for being here, and I hope many people avail themselves of your offering here, because it sounds like a great way for people who are nurses who are really just getting interested in this. Keep getting our emails, but want to really, if you're like me, you've got all these things you want to learn that are on your kind of to-do list that you just haven't got. You should see the side of my bed. It's piled with books that I call it the graveyard of good intentions. But this seems like a way to make a good intention an actionable item. So I hope that lots of people learn from you, as they probably already have with the time we've just spent tonight. So thanks for everyone who tuned in live, and for those of you who are watching it on the replay. We do these every month. They float around a little bit. We don't have a set date, but usually somewhere mid-month. So just keep an eye on your inbox. We always send them out to our mailing list and to our Facebook group and page on the days before. So Kayla, Deanna, thank you so much for being here, and wish you and our audience a really good night.
Thank you, Andrew.
Thank you for having
Thanks,
us.
everyone.
Thanks.
Bye. Bye.